Hi, this is Leila Kelly. In this presentation, I'll be addressing a specific need that I think is vitally important and should be one that takes precedence over any other, issues that could need to be addressed. I'm not saying others aren't important, but I think this particular issue that's at stake is an important one, and it's the issue of mental health, or particularly when there are struggles with mental health. Um, Struggles with mental health often lead to things like depression and anxiety. Um, and according to the CDC, these conditions are things that interfere with one's ability to function properly. It's different from just simply being down in the dumps or feeling blue, but something that affects someone's ability to function properly and enjoy things that they typically like to do. And another unfortunate thing about depression and anxiety is that it can unfortunately lead to thoughts of taking one's own life or suicide attempts and even actually dying from it. And that's a big reason like why that this should definitely take precedence in being addressed. Um, Again, like as mentioned, it's important that this is addressed because this can lead to suicide or taking someone's life. And just some facts about that is that suicide can affect people of any age. There are children as young as 10 that are taking their own life, sadly, and also according to the CDC. But just the mere fact that anybody that young can even possibly think of doing something like that is quite alarming. So because of the high risk of suicide for college students, definitely setting up a program that addresses struggles with mental illness should be considered and very highly. Um, it should be highest priority because, life is precious and, we do not want to have anybody taking their own life, especially so young, but I mean, at any age for that matter. Life is precious and everyone should be wanting to live to the fullest potential that they can, have the best future that they can, and they all deserve that. So to have a sort of program like that, there are specific responsibilities that need to be taking place to have this program. And one responsibility could be for stakeholders is setting up seminars or programs to talk about mental health issues, depression, anxiety, and suicide. And this can be a way of spreading awareness to people so it can help people know what signs to look for, um, to see if someone's in trouble and needs help. Um, just to help someone in crisis and recognize signs, perhaps even recognize some of the signs that are a little harder to notice at first, because that can happen, that there's signs, but it's hard to notice. And after something unfortunate's happened, in retrospect, we can end up seeing signs that, we're not even sure how in the world that we missed them in the first place. Counseling services need to be available, and this is something that all colleges and universities typically have. So definitely need to continue that, having counseling services where students can easily make appointments to talk with professionals and, maybe learn some coping strategies or things that they can do to get better if they need to be referred to for taking medication like antidepressants, then so be it. If that makes a difference between someone choosing to live, then it's worth it. Events or activities for students struggling with mental health issues would also be great, and that way those who are struggling can get together with others who might be struggling with some similar things so they don't feel so alone. So to make these things happen, funding would be essential to have so that these resources can be available. And if anything, it can be done to help fund this program. If there's fundraisers, whatever is allowed ethically, be willing to use, to help fund this type of program. And it is very important to allocate student affairs resources to struggles with mental health because students need to feel safe. The reputation of student affairs departments is that they make students feel safe and have a fulfilling college experience, but that can't happen if their mental health is compromised negatively, if they're depressed or have anxiety. And students do deserve to feel safe. Also, again, this should be considered because life is precious. Suicide is very real, and at any age, students deserve to have the best future that they possibly can. And as mentioned before, if they're very young, but any age for that matter, but especially really young ages, like even going back to being as young as 10 years old, to consider doing something like that, it's very alarming, and it's very important that it be taken seriously. So again, vitally important to consider a program that addresses mental health issues, as that is something very common, more common than people might think among college students, especially when they're dealing with significant changes in their life when they first come to college. It's everything. Thank you so much. Take care.